All right. Good morning or afternoon or evening, wherever you are. My name is Adriana Arcia, and I'm from the University of San Diego. And I'm presenting on behalf of my co-authors. The reason my name is in bold is because you only get me today. I'm sorry. Sam Stonebreaker, Sabrina Mangal, and Mai Chulor could not make it, but they were my co-authors for this tutorial. And it's called Preparing, Conducting, and Analyzing Participatory Design Sessions for Information Visualizations. Excuse me, I have no relevant commercial interest to disclose, and this tutorial is based on an instructional workshop that my co-authors and I presented at the 2023 AMIA Annual Symposium. That's the American Medical Informatics Association. By the end of this tutorial, I'm hoping that you'll be able to describe multiple variations on the participatory design session format, to be able to write visualization objectives that support your overall project goals, to summarize important considerations for setting up a participatory design session, to be able to actively support the conduct of a participatory design session, and to draw actionable insights from your design session data. So that's what we're trying to accomplish today. And I'd like for you to speak up in Discord. If you're just joining and you haven't used Discord yet, please look for your welcome email. You would have gotten about a week ago, and it would say, hello, or welcome to IEEE Viz 2024, or something like that. Look for that email, and if you scroll down to the bottom, there is a Discord invite. And if you click on that, if you haven't used Discord before, then you'll need to make an account, I think. But if not, just join us. We are in room Bayshore VII, or VII, if you will. And I want to get a sense for who's in the room, because this is a little bit like talking into the void, but later on we're going to be together in another Zoom. So I kind of want to know who's here. It'll help me plan a little bit. Just say where you're joining from, if you've been a leader or a participant in a participatory design session before, or maybe you have experience with qualitative research, or if you're just new to this, we're happy to have you here either way. And as your questions come up, feel free to put them in the Discord. I have the Slido up as well, but I like using the Discord because then maybe if it's something that I already said, another participant can chime in and help you out. I'll be trying to check in on that as we go. It's over here, my Discord. So before we get started, wanted to say a little bit more about the kind of InfoVis that I'm talking about. So here's some examples from my prior work. I've been doing this for about a dozen years. And when we got started, this is from our very first project. The purpose of the project was to return research data to participants. So we had a large community cohort, and we wanted to return the data to them in a way that they would find useful and actionable. And my PI said, Subaka, and she said, let's do some infographics. And I said, that sounds great. And then we looked at the literature and found nothing to tell us how to show somebody their blood pressure. We found stuff about medication administration, about risk, but nothing about something like blood pressure. So we launched into a participatory design process with all of the confidence of complete novices, and we learned a lot, and we've been doing it ever since. So this, oh, hi, Alvita. We have developed this kind of thing. We started out with returning research data to participants. Here's another one from the same project where we're showing somebody their BMI. And you'll notice that we use a lot of number lines. We found that this was very effective for a lot of the kinds of data that we wanted to show. But here we're also using the body silhouettes to help out. And then a subsequent project we did with Hispanic family caregivers of people with dementia. And again, trying to return research data. And if I tell you that your score on the Zaret burden interview is 42, you'd say, okay. So this is really to help people interpret their scores and their information. And then here we're getting into clinical data. For this project, we wanted to show adults with asthma their results of their pulmonary function testing, which in many places is not shared with the patients because it's really complex data. But we found a way to extract some little bits and pieces that we thought would be interesting and useful for the participant. And As it turns out, the hard part of the sense-making process here is not the 72%, it's not the categories, it's liters of air, because Americans don't know liters, and also we don't think about our lungs that way. So that's where people really needed a little bit of visual support. So it gives you an idea of the infographics that we have that are tailored to the individual viewer. But we also have, this is from our most recent project, rather than being tailored to the individual viewer, this is tailored to the community-based organization that's sharing the information. And so they can put their logo on it, they can go in and edit different aspects of the image. This is just the first 2 pages of a guide to COVID-19 testing. We also have one about vaccination. But you can see that over the years, our work has, our visuals have gotten a lot more complex. But this is the kind of thing that we're talking about. Hello, everybody. Thank you for joining. Okay. All right, so our agenda for today, I'm going to go over a few definitions, and then we're going to go through the design session manual, which if you scroll up in the Discord, you won't have to go very far. It looks like this. This is what I'm going to go over, and in our didactic portion. And then towards the end of the first half, we're going to get into the interactive exercises. So we're going to go into another Zoom, and where we can talk to each other and have breakout rooms if necessary. And then we're going to start our first of 3 exercises. You will get a coffee break in between, but we're going to have, for each group, if we need more than one group, you'll have somebody who will volunteer to be a design session leader to manage the group and lead the discussion, and somebody who's a note taker. You can optionally designate somebody to be a co-lead, and then everyone else in that group will be participants. And you'll stay together for the whole tutorial. So after the coffee break, we'll do a little mock design session. You'll get a chance to practice the skills that we talk about in the didactic portion. And then you'll just transition directly into debriefing and analysis. So excuse me, if in exercise 2 you were a participant, you were giving feedback on the visualizations, then in exercise 3, you're now part of the research team and you're doing the analysis as well. Then we'll report out, we'll talk all as a group, and I'll close out with some top tips, just some reminders that I think would be helpful. Because of the way that this is structured, if you are volunteering to be a design session leader or a note taker, I really hope that you'll be able to stay with us the whole time, because it is that the group cohesion is dependent somewhat on you. So hope you can do that with us. So again, if you're just joining, please say hello in Discord. Lets me know kind of how many people are in the room, say where you're joining from. If you are have any experience with participatory design, either as a leader or a participant, or if not, if you have any experience with qualitative research, or if none of the above, just say, I'm new to this, and that's great too. And if any questions are coming up, be sure to share those in the Discord. You can also use Slido. We have that as well. Okay, so why did we develop this tutorial? What happened was that been doing this kind of work with the help of our research staff and our PhD students, but then in a more recent project, we needed to train people outside of our organization to help us with design sessions in languages that we didn't speak. And I realized I need a manual. I need to operationalize this. All the things that we've kind of gathered over the years, put them in one place. We have a revise and resubmit. Hopefully this will be a publication very soon. But in the meantime, we get to do this together. And you have this document in the Discord that is it's exclusive early access. So one of the reasons that we did this is because we learned that some of the things that make a really big difference in how smoothly the design sessions go, how efficient they are, how much rigor, really depended on these kind of smaller practical details that nobody was talking about in the literature. And we felt like we suffered and learned the hard way. You shouldn't have to. There's also some unique considerations for visualization compared to text as far as participatory design goes. We'll talk a little bit later about image tracking and the need to have a system to do that for version control. And also, we've worked almost exclusively with lay participants, and they're different from professional audiences. They don't have to interact with your viz if they don't want to. And so in a way, the bar for the design has to be a little bit higher, because they're not going to just stick with it if they don't feel like it. So there's also just different things with people who working with participants who are not used to doing this kind of activity. So, all right, wonderful. We get a nice group forming. All right, so as I said, we are going to be going through the participatory design session, yes, design session manual. So I'm just dropping that in the Discord again, so that it's handy for you. And I'm going to go through some definitions, and I want to make it clear that there is a diversity of opinion about what these terms mean. I'm not claiming to have the A1 plus definitions. These are what we've been working with, and these are for the purposes of today. So, take it with a grain of salt. You'll have other people who feel some kind of way about how participatory design should be done, and they'll say, well, we're doing it wrong. It's how we've been doing it. It's been what's working for us. So, just take that with a grain of salt. And if we have in that document, there is table 1 that has some additional definitions in case you need them. So, how we're defining participatory design is as a method for collaborating with members of our intended audience of our visualization to develop a creative product, in this case, a visualization. And this process is usually iterative. And the goal is to have a final product that's culturally acceptable, visually appealing, and hopefully meaningful to our intended audience. We're defining an information visualization as something that typically combines text and images. It's a visual product that has a communicative intent. So if we're thinking about that explore, explain continuum, we're on the explain side, which we contrast with a data visualization, which is primarily on the analysis, discovery, explore side. Here we go. So you'll also hear me talk about prototype designs. So these are visualizations that are still under development. We distinguish between the prototype design, which is usually like the full thing, and a graphical element, which might be just like a pictogram or an icon or something like that. And then anything that we're putting in front of the participant we're just calling that a stimulus. So I like to work on cardstock. We give people stacks of paper, and they're like, okay, let's all look at this one together. And I like cardstock because it's easy to handle. And so whatever you're putting in front of the participant, that's going to be a stimulus. I also make a distinction between generic and tailored infographics. A generic infographic looks the same for every viewer. It's a kind of your typical infographic. A tailored infographic is incorporating some information about the viewer, ideally, such as their blood pressure or their BMI or burden score. Or in the case of the one that I showed you towards the end, it's tailored for the needs of the community-based organization. So we have kind of different layers of tailoring. And then if you're familiar with qualitative work, you're probably familiar with the term saturation, which is kind of how you know you're done with your data collection. In this case, design saturation is very similar. We're getting to the point where our participants are expressing satisfaction. They're saying, yes, this works for me. I understand this. The feedback that they're giving us is no longer leading to substantive design changes. So if they say, make this orange slightly darker, we probably don't need another design session for that. But our research team is coming to consensus that we've kind of arrived at the point of diminishing returns, that additional data is not going to move us closer to our visualization objectives. So that's kind of our practical way of defining design saturation. So I want to situate design sessions within the larger participatory design process. We start, at least this is how we've been doing things, we start with formative work. So usually it's informed by a literature review. We do some kind of needs assessment. So in the instance of the COVID-19 graphics, we did interviews and focus groups with members of our community. And that's when we learned that it was really the community-based organizations that were the boots on the ground, and they were the ones who needed support. From there, we create a design brief. So this is a short document that helps us to really think through and define what are our objectives, who's our audience, maybe some preliminary content, what are our key messages, what are the key requirements? For instance, where would someone see this visualization? In what context? Is it something that they're going to get in the mail and they have to interpret it all on their own? Or are they going to be in a clinical visit and there's a clinician there to mediate that interaction with them? Those kinds of things, your budget, your timeline, all of those things you kind of lay out in your design brief. So if you'd like to see a template for one of those, just follow that QR code. This is a publication that my colleagues and I collaborated with our designers, actually, and we wrote a paper about how to work together, because scientists are not your typical design clients. We're not the typical corporate client, and scientists are also generally not taught how to work with design professionals, and we don't always understand what they need. So this is mostly targeted towards scientists to help them understand what it is that designers need and expect and how to make that a fruitful collaboration. So in the supplementary materials for that, you'll find a template for the design brief, as well as a template for a scope of work. Then we move into what I'm calling the expert design phase. Not everybody does this. Some people go directly into design sessions and start with a blank sheet of paper and Post-it notes and that kind of thing. We find that it really helps when people have something to react to, and it makes for a more productive and oh, thank you, Andrew. Makes for a more productive process, more efficient process. So I start working with my designer, sometimes with a content expert, and we start hashing it out. We think, okay, how many different ways can we think of to show somebody their blood pressure, right? We ideate, we come up with lots of different sketches and ideas, and then we go, okay, these are clearly stinkers. We're not going to bother with those, but these are looking okay. We might do like a peer critique session. I run a monthly visualization design studio, and I'll try to remember to put the link to that in the chat later. But we might get feedback from our colleagues, especially content experts. But then we'll come up with kind of like our starting set of prototypes, and that's what we take to the design session. Again, design sessions are an iterative process. We hold them with members of the target audience. That can be kind of broad sometimes. For instance, Sabrina, one of my co-authors, she wanted to do something for parents of children who are hospitalized with a urinary catheter, and it's all about infection prevention. But kind of unfortunately, any child could be hospitalized at any time. So really the only requirement for her participants was that they be parents. They didn't have to have a child actively in the hospital. And what we're going to do during these design sessions is get some preliminary evidence that we're meeting our objectives. So it's not super rigorous, it's not a formal test, but I'm looking to see my intended meaning. Is that the received meaning? What people tell me they're getting from my infographics, is that are we on the right track? If someone says something completely different, then we go, maybe this isn't working. Usually my primary objective has to do with some kind of comprehension, but you can have other objectives, and we'll talk about that in a little bit. So let's say we've had a very successful participatory design process. We've done a variety of iterations, and we get to our final set of graphics. We're like, yes, this is what they should look like. And then we want to do a formal evaluation, something with more rigor that helps us to determine whether or not we're meeting the stated objectives. So whether that's formal comprehension testing, whether that's behavioral outcomes, maybe you do something about getting your flu shot. Do people actually go out and get their flu shot? That kind of thing. You're going to do that formal evaluation. And when you see, hopefully, that they're working as intended, then you need to prepare for implementation. So in our for our tailored infographics, that means usually that we have to have bespoke software that's going to generate the visualization for us. If you have a generic infographic, then things would be a little bit easier. But you might also need something like an implementation guide. I learned a little bit the hard way that it's not necessarily obvious to someone how they should use an infographic to do their patient teaching, for instance. So you might create a guide for the clinicians that tells them, gives them suggestions for what they should say when they show this and how they can use it, maybe how it fits into the workflow. Maybe you have to do some training to help people use your infographic effectively, whether it's generating it or deploying it in some way. So that's kind of the design process. Like I said, we're going to focus on the design sessions. We are going to talk about objectives, though, that are kind of earlier in the process, just because they're so important and because you're going to be thinking about them as you do your design sessions. Okay, so visualization objectives. It is absolutely essential to have clarity and specificity about your visualization objectives at the outset, because you can start going through the design sessions and are you going in the right direction, right? How do you know that you have been successful? So you need to have objectives that are going to be measurable. That's going to be very important. And in my experience of coaching people through this process, I find that people's first try for their, excuse me, objectives are often too vague. So you might have someone say, well, I want people to understand about blood glucose. Okay, well, understand why, right? I can't make a multiple choice question for that or a rubric for that. I need, what about blood glucose do you want them to understand? And so getting people to go through that process and really think it through, it can take a little bit of practice. If you're interested in practicing it more and you happen to be going to the American Medical Informatics Association conference in November, we will be doing a tutorial on Saturday about that. So here I want to give a big ol' tip of the hat to Adar and Lee Robbins, who came out with this paper that I cite all the time and tell everyone they should read because I think it's really great, that helps you think about how you can frame your cognitive visualization objectives. And they use this structure of the viewer will verb noun. So for instance, the viewer will evaluate and then whatever it is that you want them to evaluate. And they suggest that you use Bloom's taxonomy for determining what learning level you have. If you're not familiar with Bloom's taxonomy, it's really useful to help you think through kind of the intensity with which somebody needs to learn something. So do they just need to be able to remember it? They need to remember the name of their medication, or do they need to apply something? Is there a concept that they're going to actually have to use in some way, all the way up to creation and synthesis? Your choice of objective can have a really big impact on the visualization. So in this paper, Adar and Lee Robbins, they say that they had, let's say they have a data set about forest fires. And their first underspecified objective is, our objective is to teach viewers some factors of forest fires. Okay, well, that's a little bit vague. But with feedback, they were able to break this into more specific learning objectives, including viewers can describe which kind of tree is more likely to cause a fire, which when you think about it, which kind of tree, that's going to be maybe like a part to whole relationship, like which tree is contributing most to forest fires. And viewers should be able to describe the periodical pattern of forest fire in a year. Well, that's not going to be a part to whole relationship. That's going to be maybe some kind of time series, maybe a line chart, something cyclical, something like that. So the process of doing this is also really useful because it can help you narrow down on what kind of visualization format is really going to serve your needs and help you to meet your objective. We have a question here in the Slido. I would be really interested in any evaluations of visualizations with behavior changes, particularly long-term. I can refer you to the work of, I'm sure there's other stuff out there, but this is just what pops into my mind because I work with her all the time. And it's, look at there's a paper by Samantha Stonebreaker that came out not that long ago where they showed visualizations related to HIV self-management in clinical care. And then they looked at some more proximal outcomes, such as HIV knowledge, some intermediate outcomes. I believe they looked at self-efficacy for self-management, but then they looked at distal outcomes like viral load, and they actually saw a reduction in viral load. The behavior is actually kind of hidden in there because they're not measuring, let's say, adherence to medication directly, but presumably they did something to get their viral load down. So that would be an example of a behavioral change. So in addition to cognitive visualization objectives, oh, I'm sorry, here we're gonna practice. So here's an example of an underspecified objective, which would be to understand the difference between COVID-19 tests. When we did our formative work with our community members, one of the things that we learned, the important things that we picked up, were that people felt comfortable with positive and negative as test results. They understood what that meant. And also they understood that no test is 100%, which was a relief to not have to try to explain that to people. Since I didn't want to have to get into sensitivity and specificity with the general public, but people understood those things. What they had less certainty about, less accuracy about, was the difference between the tests. And in fact, one of the most popular tests in our neighborhood in northern Manhattan was antibody tests. And people would tell me, well, because it's in the blood. Like the more invasive it is, then the more accurate it is. And it's like, yeah, but an antibody test is not going to tell you if you have COVID right now. That's a problem. So we realized that that was going to be one of the main things that we wanted to show people was the difference between the tests. So we can improve this and say to understand the difference between COVID-19 diagnostic and antibody tests. But we can improve this even more by saying to recognize that COVID-19 diagnostic tests detect current infection, whereas antibody tests detect past infection. So just to give you an idea of how we can improve upon that cognitive objective. So we're going to practice. Here, the original is, let's say we want to recognize the harms of sedentary behavior. And I've given you just a little bit of some facts about sedentary behavior. I want you to think about how you can improve this. And when you have something, just share it in the Discord, see what you think. So I'm just going to give everybody a minute to think about that. I see some people are typing. We've gotten some ideas about how we can improve this objective. I mentioned earlier that I run a monthly visualization design studio. I just put the link to that in the Discord chat. If you scroll down to the bottom of that page, you can put in your name and email address, and you'll get the newsletter with information about when our next session is. So we have 2 more sessions scheduled for the rest of this year. We do them on Tuesdays at 1 p.m. Eastern, 10 a.m. Pacific. And you should be able to the previous newsletters are there. You can get a sense for what we do. We have a Google Drive where you can see recordings of our previous sessions. And hopefully I think, I don't know if we're going to do December or January. I'll be doing my Viz and Amy a recap. So I can look forward to that. All right. So Aaron says, goal for participants to understand how an increase in sitting, reclining, or lying down during waking hours is associated with an increased risk of heart disease, stroke, and death, even if they engage in regular exercise. So we're taking, Aaron has gone for the gold and gone and put everything in there. Chase says, identify and describe the risk variables associated with sedentary behavior, heart disease, stroke, and death. Okay, we're getting some really good stuff here. Focus on specific harm or issues, since one infographic will not cover all the possible issues. You're bringing up a really important point, which is that sometimes people have very ambitious ideas for how much they want to try to stuff into a design, and maybe it's not all going to fit into one design with clarity. So these are some good ideas. You can kind of take it and put it all into one objective, or you can break it up. So you can just say, for instance, that you want the viewer to recognize that sedentary behavior is associated with an increased risk of death. And that right there, that could be an item for your comprehension testing. So I know there's a little bit of a lag here, so I want to keep going to keep the pace going, but I'm loving that you all are participating in the chat. It's great. So Adar and Lee Robbins also talk about affective visualization objectives, because we've been talking about what people think, and now we're maybe working into what people feel. So they give these examples that the first thing is just observing that people hold a range of beliefs. And then beyond that, you can actually just take a position somewhere along that range of beliefs. Maybe you can strengthen how much conviction you have in a belief, or connect or compare two beliefs, or the kind of the most intensive thing would be to behave in a way that's consistent with that belief. Let me see what I have next. So we're going to practice with an affective objective. And I know I'm going through this quickly, but we've got a lot to cover, and I want to make sure we get to it. So the original affective objective, which is maybe underspecified, is to be motivated to address sedentary bouts. So think about how you can make this a better affective objective. I'm actually going to go to the previous slide here so you can get a reminder of what the different levels are. Okay, we've got a brave soul who's typing. He's going to share their ideas with us. And to be clear, as you can see, there's not one right answer, right? You've got even if you use these 5 verbs, there's 5 different options right off the bat, regardless of what then you actually want people to be able to do or feel in this case. Okay, so Stephen says the participants should be able to identify long activities in their daily routine that are sedentary. Okay, so I think that's still kind of cognitive objective. Words like identify are usually associated with cognitive objectives. Here we're looking for something related to feeling, relating to emotions. Let's see, we've got some other people contributing. Well, Stephen, you bring up a good point, which is often that we often pair cognitive and affective objectives, because usually they work together for sure. feel like I should be tap dancing or something to keep you entertained. Okay. Alvita says, takes a position to agree that change in sedentary behavior lowers the risk of X. Yeah, you can agree or disagree. That's a perfectly great example of kind of one of the lower level affective objectives. Thank you, Alvita. Jonathan says to agree that sedentary behavior has negative impacts. Even yeah, and so we're adding more specificity. To what extent do you agree that sedentary behaviors are harmful to your health? So thank you, Xiao. This would actually be a really good example of turning our objective into an item for like a multiple choice question or a yes or no or an interview question, making it really measurable. So that's a really great example of how you can do that. Okay, Johannes says life expectancy, if the participant's current behavior does not change, you only have X number of years left to see your grandkids. Um, I think that's still kind of cognitive. Um, then maybe you want to feel some kind of way about the fact that you only have X number of years left. Increased motivation in belief, strength and conviction that changes in sedentary behavior can change one or more specific health outcomes. Thanks, Chase. That's a good example of a higher level objective for affective. So these are great. Thank you so much. I appreciate you all chiming in. So to give you an idea, let's see, we had to be motivated to address sedentary bouts. I came up with, for 5 different levels, to observe that people have a range of beliefs about sedentary behavior from not harmful or even beneficial to harmful. To agree that sitting for long bouts is unhealthy, to strongly agree that sitting for long bouts is unhealthy. Maybe we're strengthening that position. To value being healthy more than I value watching a long movie interrupted. And the hardest one, to get up and do a few minutes of light activity every 30 minutes. Yesterday, I was, listening to sessions and taking notes and all of that stuff. And I was parked on my butt for a very, very long time. Easier said than done, right? To get up and move around. I hope that you get up and move around as you need to. Okay, so we've talked about objectives. I encourage you to read those papers. Also, take a look at the work of, let's see, Brian Zickman Fisher, Nat Benda, and Jessica Anker. I put their names there in the chat. They put out a paper in JAMIA last year, I guess now, where they talk about how when we talk about comprehension objectives, oftentimes we're not being granular enough, and there's different kinds of comprehension. So I encourage you to take a look at that paper and look at their taxonomy. Okay, so we've defined our objectives and our audience in our design brief. We've decided on our content, and maybe we've worked on a starting set of prototypes with our designer. I always like to work with a professional designer. I can do some things, but I just don't have the skill to execute what's in my mind. So it's very important for me to do that. So now we're going to talk about preparing, conducting, and debriefing / analyzing from the design sessions. So we'll start with some possible variations for these design sessions. And if you look at the document that's in there, you'll see table 2 helps you compare the pros and cons of the different variations. And that can be, in person versus virtual. We started out in person and then COVID happened and we started to see how can we do this virtually. Individual versus group. We started out with groups, but especially if you're in a virtual data collection, or especially if you have a lot of content, sometimes it's better to work with one person at a time. It depends. And then we also started off with no preview, where we wanted every participant to be naive and not have seen any of the visualizations beforehand, because we wanted to be there for that first impression and see what do they think it means before they've had a chance to think about it more. But Mai Chu Laura, one of my co-authors, she was working on something that was going to be used by professional interpreters, and she wanted to give them a chance to look at it and think about it and have a more deliberative process. And so she let them see the visualizations, the stimulus, the prototype designs in advance. So depending upon your purpose, you're going to choose these things. And then there are some possible tasks that you can do during your design sessions, or even outside of your design sessions. I have design surveys listed there. And we're going to go through these one by one. In terms of documentation, we started out doing audio, but Zoom makes it very easy to do video. I'll be honest, we've never done video in person. I think it would be challenging to do that well because you'd want to have kind of an overview of the room, but get enough detail where you can see people's facial expressions, but also, I don't know, you might want to have like an overhead view so you can see what people are looking at. Could be a little bit tricky. And then we would normally take notes, would have somebody, a dedicated note taker, who could take notes in the moment, observe people's body language and that kind of thing. But maybe you don't have a note taker. Maybe it's just you. In that case, you could take notes from a recording, maybe not as robust, but if you have limited resources, sometimes that's an issue. And there is, I believe we have a section here. It might not be in the one that you have. We have a section in the paper, the manuscript, about kind of working with in constrained settings. If you have limited resources, how you can still do these things. So, for instance, instead of printing out these things, you might project them on a screen so everybody can see them at the same time. Then group composition. You must group people by language. So if your visualization is in English and Spanish, then you need to separate the English speakers from the Spanish speakers because the visualizations will be different. I always do things in English and Spanish. More recently, we also did Bangla and Chinese, which added a whole new layer of complexity. Is it possible to do asynchronous individual? I would say that that would be, we've never done that. I think that might be hard to maintain with a layperson. I think with a professional, it might work, but with a layperson to get that kind of continued engagement and get quality data, it might be difficult. We also sometimes group participants based on some other variable that we think is important depending upon the topic. So if you have something about sexual health, for instance, then you might want to group people by sex or gender. Or if you're talking about treatments, then you might want to have newly diagnosed people together in one group and expert patients who know all about their health condition in another group. People often ask me, okay, how many of these should I do? And how long should they last? And how many people? Typically, we do 60 to 90 minutes. We try not to exceed 2 hours because then fatigue starts to set in for not just the participants, but also for the research team. I find that an ideal size tends to be like 4 to 8 people. But then again, depends upon what it is that they're looking at. If it's much more complex, then maybe fewer people. If you're doing virtual sessions, I think it's really hard to get that group dynamic going on a Zoom call, for instance. So virtual sessions tend to be more amenable to an individual participant. And we want to continue doing this until design saturation. And I cannot predict how many sessions that's going to be. And that's one of the most difficult things about this kind of method is not having a good timeline and not knowing how long this is going to take. I find that how many sessions, it's really more about how many iterations rather than how many sessions. But the number of iterations, it's going to be fewer if what we're doing is just kind of a tweak of something that we know has worked in the past. Whereas if we're really breaking new ground, then it's, it's more new, then it's going to take more time probably to sort out the details and figure out how it's going to work. We have done anything from 21 sessions for our very first project when we didn't know anything. And I've done as few as 5 when we were doing something that was already kind of more familiar territory. Okay, so then environment. When you're working in person, I think it's pretty logical that you want to have an environment that's quiet and private. Appropriate lighting, though, is also important. You might not think about it. You want to make sure that the lighting, a lot of times institutional lighting can be too yellow or not bright enough. It needs to be bright enough that people can clearly see the paper and or the stimulus, and that the colors are going to be relatively true. If you're virtual, it can be a struggle to get people to show you their whole face. My grandmother is nearly blind, and when I call her on FaceTime, she puts her phone up like this really close, and so I only see her forehead when I talk to her. If you're only seeing your participant's forehead, it's harder to get good data. So if you can try to get them to um, angle their camera so that you can see their full face, that's really helpful. And then just as you would, if you were doing interviews, you would have an interview guide. You're also going to have a design session guide. And I believe, if you need a template for that, let me know. I'm wondering, I don't know if we put that in the manual, but basically these are the elements that you want to have in there. You want to introduce who's in the room and what their roles are. You want to establish ground rules, such as, all opinions are worthwhile here, and try not to talk over each other. That can be difficult for some livelier groups. You want to state the purpose of the study and who's funding the project, to inform participants about what you plan to do and about how long it's going to take. You want to encourage candid and honest feedback. And this is really important to try to get around socially desirable responding, because the participants, that your team has designed these things, and oftentimes they want to please you. And the way that I work with this is that I tell them, look, we want to make them as good as possible. We want to make them better. So if you don't tell me that something's wrong, I can't fix it. So I'm counting on you to tell me how we can make it better and what's not working for you. And then sometimes people struggle with the task. So for instance, we were trying that BMI graphic that I showed you earlier, we were trying to get someone to compare, I think, two different versions of that graphic. And one participant, she just didn't really get it. And she's like, I like the part that says normal. And so sometimes if you think that the participants might struggle with understanding exactly what they're supposed to do, you might have to role play it, which is why it's really useful to have a co-lead and or a note taker with you, so you can kind of show how you're expecting them to interact. For the stimuli, we like to use what I call a winnow and refine approach. So we start off with, like I said, as many ways as we can think of to show somebody their blood pressure. And then we winnow those down. We say, okay, these are clearly no good. These maybe have some potential but need work. This one's working well. We're going to keep it that way. And we're refining as we iterate. Especially if you have a more complex graphic, if you have a lot of stuff in it. Sometimes it's useful to refine individual graphical elements before you actually assemble them into a prototype, because it's a lot of work to generate lots of different prototypes. So for instance, in the one that we saw earlier with the COVID-19 testing, we had these pictograms to show a deep nasal swab versus a shallow nasal swab versus like a saliva versus blood. And so we came up with kind of several different styles for those. And we did a design survey in advance where we had people say, which, if any of these work for you, the thing that you think are clear. And based on that, we made decisions about the style of those graphical elements before we then put them into a full prototype. And that is often very useful. Okay, tracking iterations. It's really, really important to keep track of all your versions. And you want to be able to keep track even if the change is very small. I had one situation where the designer had spelled sugar wrong and spelled it with an ER instead of an AR. And that was the only difference between one version and the next. So coming up with some kind of individual code, unique identifiers for every one of them is going to be very helpful. But I like to capture these other key metadata. I like to have, in addition to the unique identifier, I want to know what are the relationships between the iterations. Are these like siblings, or is there a parent-child relationship, or is this a hybrid of two different ones? why we made changes to them, because believe it or not, you will forget very quickly, and who saw them. So previously I had tried to do this in an Excel spreadsheet where I was using it kind of as a blank canvas and just dumping images on it, and that did not load well. It is not meant for that. I don't recommend it. Lately, I've been using Airtable, which is a relational database, and this I found to be very useful. It's very user-friendly. They don't pay me. I'm sure there's other tools as well. But what we did was for each image ID, you can drop the image in. You can just drag and drop it, and then you can give it some keywords. You can, have the status, the language that it's in, for instance. But one of the things that's really useful is to be able to identify relationships between these. So we see that image ID number 150, that the previous version, the parent of that, was 141. And then we ended up going off and actually making a couple of other versions of it, and those were 170 and 171. So that's super useful to keep track, and you can actually make a pedigree chart where you see how your iterations have developed. And then in another table, we had the sessions. So we had the session number, date and time, location, the language that it was in, how many participants, and which images were shown. And so it makes it very easy to see how many people saw number 172, or who saw 172. You can keep track of, this is not research compliant, so you wouldn't put any actual participant data in there. And cut off from the first one, you would also have notes, other things, what has been done, what has not been done, that kind of thing. But I found this to be very useful for helping me keep track. And this becomes part of your audit trail when you're thinking about your qualitative rigor. Somebody else can come back and look and see, and you would have the reasons why you made changes, and justify your design process. This is why we did things. I wonder what type of camera you would usually use for a recording design session. Long-time recording is always challenging and cause overheating. Yeah, we have not done video for an in-person session. We've only ever done video for Zoom, which is very easy. You just click the record button. So unfortunately, I can't answer that question for you. But if anybody knows, if anybody has suggestions, please share them in the Discord. Another thing that we learned was very helpful is to have a structured notes template. Originally, our things were very, very simple and had a lot of white space. And so we would just write directly onto the stimulus itself. But as our designs got more complex, we ran out of room, and it's hard when you're taking notes to say what people are talking about. So what we did is create a structured notes template where you have, the metadata about when the session is, who's there. I make a little seating diagram because then I can remember, oh, it's the person who was sitting over to my right. But then for each thing that you plan to show, each stimulus, you have that little thumbnail in the box, and then it makes it very easy to capture direct verbatim quotes, any action items related to that image, and some observations. This is your own aha moments or your observations of people's body language, that kind of thing. If we take a vote between, do you prefer this one or that one? You can keep track of that as well. Okay, so there's a lot of prep that has to happen. And then once we're actually running the sessions, you want to be clear on who's going to be there and what their roles are going to be. So the design session leader, typically this is going to be the person who leads the design team, because they know better than anybody what are the decisions that need to be made, why we've made certain changes in the past, that kind of thing. They're the person who guides the discussion, and ultimately they're going to be the ultimate arbiter of the design decisions. They're also responsible for content accuracy. Once in a while, we will have somebody else lead the design session. It's usually somebody who's very, very close to the project, like the project manager. We have had a couple of instances where someone who's not so close to the design team has led a session because it was in Chinese or Bangla, and we don't speak those on our team. And I'm not going to lie, it's not as good, right? Because they don't know all of the details and the ins and outs of the project. And so the data they can elicit is not going to be as targeted and rich. You also want somebody who's trained to take notes, keeping track of participants' reactions to what they're seeing and nonverbal cues using ideally that notes template. And if you can swing it, if you have the resources, it's really nice to have a project manager. So somebody who's going to assist you with the scheduling or who can support the session. So helping you with the consent process, maybe if there's a demographic survey in the beginning, kind of getting that stuff done in a timely manner. And oftentimes my project manager was also my note taker or my co-lead. During sessions, we want to do what we can to preserve participants' respect and dignity, because I'm not going to lie, sometimes people say things that are boneheaded or inaccurate or sometimes offensive. That's not usually the case, but it does happen. Sometimes people say things that just you don't know what they mean. It doesn't make any sense. They ramble. It does happen. And it doesn't matter what people are saying. You want people to leave your session with the feeling that their contributions have been respected and that what they said was valuable to you, because ultimately they are the experts in their own experience of what they see. So it's very helpful to have a good poker face. And when people say unconventional things, you can say, "Oh, wow, I hadn't heard that before. Can you tell me more about that?" Right? And take that kind of approach to it. Okay, so then when you're actually running the session, and you'll have decided in advance what you're going to do, but these are some of the tasks and prompts that you can use. If you look at table 4 of the guide, there's some additional prompts to suggestions for things that you can say to help keep your design session running smoothly. But one of the things that you can do is ask people to choose the best option. And in this case, you're telling people, this is the target concept. Which of these, if any, clearly conveys that idea? So we're giving people the concept, and then they have something to choose from. This is particularly good for when we're still working with graphical elements. A different tack would be eliciting meaning. Here, we're not telling people in advance what it's supposed to be. We're just saying, what do you think we're trying to tell you with this infographic? What does it mean to you? And hearing what they have to say. And this is very useful for preliminary comprehension to see kind of what is the message that people are getting. Does it match what you're intending for them to get? We also want to get feedback. So I might say, okay, you've seen this one, you've told me what it thinks. Let's show another one. It has the same information, but it looks a little bit different. Tell me what you think. Which version do you prefer? We might do a voice vote or a hand vote. And we ask, how can we make this easier to understand? Is there imagery we shouldn't be using? Should we be using something else? This is where we have that kind of group discussion can be really useful. And then we can also generate new ideas. Like, is there something else that we should try? What other images would help to tell this story? When you're conducting the design sessions, the leader it's very helpful if you can narrate kind of as you go, anything that's nonverbal actions or behaviors. And the reason you're going to do this is because then when you're listening back to your transcripts later, you know what's happening, right? Which image people were looking at, what was happening in the room. Maybe you remember, maybe you won't. So one of the things that you can do is use people's names. Usually you use a tent card to have someone's name in front of them, and they don't have to use their real names. Sometimes people are like, I'm going to be Daisy Duck. Okay, Daisy, right? And you call them Daisy for the whole session. But you can use people's names, so then the person who's transcribing can keep track of who the speakers are. That makes it a lot easier. If there's nonverbal actions, oh, David, I see that you're pointing to the upper left part of the page. Or Belinda, you're shaking your head no. Tell me more about your thoughts. This is really helpful for your future self. Another thing that you can do is you can follow the participant's gaze, especially if you're sitting directly in front of them in person. And it's actually pretty easy to see what people are looking at. You could kind of like top, bottom, left, right, kind of middle. You can see what they're looking at. And you might say, oh, you seemed surprised when you got to the bottom of the page. Tell me more about that. Because then you know what was on the bottom of the page, and that can help with your note taking and your interpretation of your data. You may also need to manage group dynamics if you have a group. And kind of the biggest issues that come up is like one person who dominates the conversation. And so then you say, okay, well, we've heard a lot from Jan. I'd like to hear from someone new this time, and kind of gently massage that. Another thing is if you might need to draw somebody out. Sometimes people need a little bit of encouragement. Another issue, especially the larger the group, is when people talk over each other, and you have to remind them, for the sake of the recording, if you don't mind, please, let's try to get one person speaking at a time. But you also want to consider how factors like age and gender influence interaction patterns. When people speak and when people hang back often are dependent upon these things. So I did a session where we had three women and one man. And I'd noticed that we fell into this pattern where the women waited for the man to speak first. These were older Dominican participants. And if I felt like they were then just agreeing with him, I might try to disrupt that, because we don't want everybody just to agree with one participant. But they weren't. They would still speak their mind and share their thoughts and contradict or disagree. And so I let it stand because it was culturally appropriate for them. It was something that they were comfortable with. And so I let it continue. If it was a different kind of group, I might have said, hey, let's try to mix this up. Who talks first? That kind of thing. So it's something to be aware of. All right, we've done our session. We have thanked the participants and sent them home. And now we're going to debrief. Ideally, you're doing it immediately after the session. And the purpose here is to come up with what are your next steps. It's kind of a consensus-based process, and you want to walk out of there with a list of what needs to happen. So for each stimulus, what is the disposition of it? Are you going to discontinue it? This was clearly not working. We're not going to bother showing it again. Are you going to iterate on it, maybe make some changes, or are you going to show it unchanged? It's like, oh, this is really working. Let's see what the next group thinks about it. You're going to walk out with a list of design changes for that next iteration, and oftentimes, a lot of them would be done by my designer, but sometimes there were things that I could do myself, and so we would divvy up the work. And then you might also make note of any design changes that you're considering, but are not going to make just yet. So going to get more data, and then based on that, we might implement this idea in the future. And then if there's anything new that you need to create based on what you learned, it's like, oh, we need to add this, this new prototype, then you would want to know what that is. And later on, when we do this, when we do our mock design session, the note taker will have at the bottom of their notes template, there's a space for them to keep track of all of these different things. With respect to analysis, we talk about it as concurrent analysis, which is what's happening during the sessions and between them, and post hoc analysis, which is what happens when your whole design process is done. And we use the concurrent analysis to kind of assess how they're performing in the moment, how they're performing in relationship to our objectives, which we were very careful to specify. We want to ensure that there's an alignment between what participants are interpreting and what our intended meanings are. You'll notice my language about that. I don't say that their interpretations are wrong. Their interpretations are what they are. Are they aligned with what we intend? That's where the rubber meets the road, right? I find that participants are not design experts, so they can't always tell me how to fix something. But if something is not working, my job as the design session leader is to diagnose the problem. And then I try to let the designer do their job and figure out how to solve that problem. So instead of saying, put the heading in red, I say, this heading isn't prominent enough. Or, people are not clear that it's a tree. I don't say add leaves to the tree, or they don't like it. I say, it's not clear that it's a tree. Let's see how we can tweak that, or what metaphor will work better than a tree. And then for the post hoc analysis, this is optional if you're just trying to get the visualizations and move on, then you don't need to do this. But I find that it's useful for me to go back through my transcripts, my recordings, my artifacts, all of those things, and do usually conventional content analysis to try to see what larger ideas I can extract from my design process. And I have a couple of papers where we talk about some of the things that we learned that are more generally applicable. So that can be really useful. Okay, we're coming up on the coffee break. So we'll probably have to move exercise 1 until after the coffee break, but just have a few more slides here before we do that. Transcription and translation. Human transcription is really nice because it tends to be more accurate, but it can be slow and expensive. I find myself sometimes using a mix of both human and machine. So I might send something off for translation, for transcription rather, but I might also get an automated transcript that helps me in that moment as I'm making decisions to find a specific piece of the audio, listen back, write down my verbatim quotes, that kind of thing. No matter what you do, you want to check it for accuracy, and preferably the person who's checking it is someone who was present in the design session. I have done transcription for some focus groups, not visualization related, but focus groups that I wasn't a part of, and it was incredibly difficult with all these Cuban men talking over each other. It was very challenging. And if you have the resources, whenever possible, it's really nice to analyze in the original language rather than transcribing, translating, and then analyzing. I like to analyze from the original transcript. Would it be possible to get access to the slides? Yes, I can do that in just a moment. Pretty much everything is also in here, but happy to share the slides. Okay. All right, so interactive exercises, we're actually running up against the coffee break. So I'm going to tell you what we're going to be doing before we switch over to the other Zoom. So we're going to make some groups and you're going to select your roles. So the roles are design session leader, note taker, and optionally you can select a co-leader, and then everyone else is a participant. In exercise 1, you're going to draft some prompts that are going to support the objectives in the scenario that you'll be provided. I'll post the worksheets here in the Discord in just a moment. In exercise 2, you're going to stay in the same groups and you're going to run a mock design session. And then in exercise 3, you're going to debrief and decide on your next steps. And then we'll all come back together to report out to the full group. As I mentioned before, it's really important if you're volunteering to be a design session leader and or a note taker, if you can commit to staying for the rest of the workshop because your group is depending upon you. Oops, let's see. Okay, so this is the Zoom. I think let's go ahead and move over there, and then people can go to the coffee break in just a moment. Let's see, we've got the slides here that you asked for. I've got the, I apparently I cannot share the slides with you because it exceeds the size limit. So if you can send me a private message, I will get them to you some other way. But we have the exercise worksheet that gives you all the instructions that you need for what you're going to be doing. And then if you are a design session leader or a note taker, you're going to get separate additional documents. We'll get those to you later. So that's the Zoom. I'm going to leave this up. And I will see you in the other room.